All right, let's get right into it. We often think of medicine as pure science, all about diagnoses and treatments. But what if one of the most powerful tools we have is actually an art form? Today, we're talking about the Clinico psychosocial case study and how it helps us see beyond a medical file and really understand the story of a human being.
And that's a huge challenge, right? A person comes to you with a problem, but that problem is just one chapter in a much, much bigger book. So the real question is, how do we, as healthcare professionals, actually learn to read that entire story instead of just flipping to the last page?
Well, that's exactly where the CPS case study comes in. It's our framework, our holistic lens, if you will. It's really just a structured way to understand a patient's health, not as an isolated event, but as something that's totally intertwined with their life, their family, their job, basically the whole world they live in.
So, where do we even begin? Well, first we kind of have to become artists, or maybe architects. Before we can even touch on the illness, we first have to build a picture of the world that patient lives in every single day.
And to get that full picture, we really have to look at it from 4 key angles. Now, the clinical stuff, the diagnosis, the history, that's obviously super important, but it's just one piece of the pie. We also need to look at the social side of things, like their family and home life. Then there's the psychological part. What are their stresses? Who's in their corner for support? And finally, the behavioral stuff, their day-to-day habits. Every single slice is absolutely essential to seeing the whole story.
The foundation for all of this really is built on the simple things, the fundamentals. Who is this person sitting in front of you? Where do they come from? And believe me, these aren't just boxes to tick on a form. They are the opening sentences of your patient's story.
This means we need to get pretty specific. We're looking at things like their family structure. Are they in a nuclear family, a joint family? We have to assess their socioeconomic status, because that can affect everything from what they eat to the care they can get. And we're even looking at their environment, their house, where their water comes from, and of course their personal habits. Every single detail adds another brushstroke to that larger picture we're painting.
Okay, so once we've kind of set the stage, it's time to dig into the plot. This is where we trace the timeline of events that make up the patient's actual health journey.
You can think of this part like a 4-step investigation. First, you look back, document their entire medical history. Then, you zoom in on right now. What's the main reason they're here? Third, you map out those key life stages. Things like immunizations or developmental history are absolutely critical, especially with kids. And finally, you explore how they behave around health. How do they use the healthcare system? What do they know? And what do they think they know?
Now here's a really important point. This whole framework isn't some rigid, one-size-fits-all checklist. It's more like a flexible blueprint. The questions we ask, the details we focus on, it all changes and adapts based on the person and the situation right in front of us.
Let's take an example. Say we're looking at a patient with diabetes. Okay, our spotlight immediately shifts. We're going to zoom way in on lifestyle. Diet and exercise suddenly become main characters in this story. We're actively on the lookout for complications, we're tracking key lab results like their HbA1c, and we're seeing how they connect with larger health programs, like the NPCDCS.
But if we're dealing with a child under 5, it's a completely different story. Here, the beginning is everything. Birth and feeding history are absolutely paramount. We're going to meticulously check their immunization records, track their growth, assess developmental milestones, and see how they're linked with programs like ICDS. See, same framework, but a totally different focus. All right, now we get to the fun part. I think it's the most exciting part anyway. Synthesis. We've gathered all this info, the context, the history, the clinical data. Now it's time to put it all together and see what picture emerges when we connect all the dots.
This is really where the magic happens. A true CPS diagnosis isn't just a clinical label like hypertension. It's a much deeper, multi-layered understanding where the medical facts merge with the bigger public health picture and, maybe most importantly, with the deeply personal human story of the patient.
So think about the diagnosis as having 3 distinct but equally important layers. First, you've got the clinical diagnosis, the medical condition itself. But underneath that, there's a public health diagnosis. What does this one case tell us about the community's health? And then there's the psychosocial impact. How is this illness actually affecting this person's life, their family, their job, their well-being? You need all 3.
A deep diagnosis is great, but it's pretty useless if it doesn't lead to a plan. So the next critical step is taking all that incredible insight and turning it into a clear, actionable path forward for the patient.
And a good management plan is so much more than just writing a prescription. It's a full roadmap to wellness. Of course, it includes clinical care,
but it also includes things like psychosocial support, rehab if it's needed, solid health education, and a crystal clear follow-up plan so they don't fall through the cracks.
And that brings us to our final section, which is maybe the most crucial skill of all, presentation. I mean, you can do all this amazing detailed work, but if you can't communicate it well, its impact just gets lost.
This quote, this says everything. It should be your North Star for any case presentation. Your goal is not to present a case, it's to present a person.
So what does that actually look like? Well, it's a huge mindset shift. You don't just dump a bunch of data points, you create a narrative, a story. You don't just focus on the symptoms, you explain how the person's life is shaping their illness. And you don't just recite facts, you tell us what you learned. What are the big takeaways from this person's story?
When it all comes down to it, this is the core idea. The real power of this whole approach is turning a mountain of separate data points into one single, unified story. And that one story, that's what leads to truly better care.
So I'll just leave you with this question to think about. The next time a patient is in front of you, you've got a choice. Are you going to see just another case file, or are you going to be the one who takes the time to uncover, to understand, and to tell the story of a whole person? The choice, as they say, is yours.